Hi everyone, we are really winding down and getting towards the end of the semester. So the last chapter we're going to cover in this class is the American model. All of what we've been learning has kind of been building up to the American model so you can understand a little bit how healthcare in the United States works. So because the American model is so complicated, I'm going to split it up into two parts, and today's going to be part one of a two-part series on healthcare in America. Previous chapters kind of started out with background information on how the models came to be. So I'm going to do the same thing for the American model and give you a little bit of background information about how and why the American healthcare system ended up looking the way it looks today. So to kind of understand how we got our healthcare, we're going to go back to around the time of World War II. In 1943, the U.S. Congress passed emergency economic measures to prevent ruinous inflation and sustain the war effort. And what they did specifically is they froze wages. So wages were frozen and employers were barred from raising them. Okay, what this meant effectively was that businesses were not allowed to reward their good employees by paying them more. And normally you want to do that in a labor market so that you can kind of incentivize employers to work hard and to do a good job. So to get around the wage freeze, many employers offered employees health insurance as a non-wage perk. The reason they could do this is because if they kind of rewarded the hardworking employees with health insurance, they were still complying with the federal regulation that says you cannot pay employees more in actual money, and they weren't doing this. They were just kind of rewarding them by giving them health insurance. Okay, so again, the reason this is kind of interesting is because this tactic of the U.S. Congress to kind of prevent inflation by preventing businesses from giving raises to their employees kind of inadvertently generated the system of employer-sponsored insurance. And so Congress inadvertently laid the groundwork for this modern-day system of employer-sponsored insurance that characterizes American healthcare today. After the war, the wage freeze was lifted, so Congress said, okay, we're kind of back to normal again. Employers, you can give your workers wages. But the idea is that some employers had already started offering their workers health insurance, and so they couldn't easily kind of renege on that. And so the insurance that they were giving their people stuck, and we're still left with the kind of traces of that today. The next kind of important thing to think about was how Truman tried to reform the healthcare system. So after the war, Truman made a push for universal health insurance as part of his Fair Deal agenda in 1949. So basically what Truman tried to do is he wanted to create a healthcare system in the United States that was similar to what was used around the world, and that everyone in the United States would have the availability or the ability to access public insurance. Okay, his push for universal health insurance failed, and it failed primarily because of very strong lobbying by the American Medical Association. So it was the actual healthcare providers who were against this, and because of their strong lobbying efforts, we didn't get universal insurance under Truman. Fast forward about 16 years. In 1965, President Johnson was able to pass universal coverage for the elderly as part of his Great Society plan. Okay, so we don't typically talk about this, but there are segments of the population in the United States that do have universal health insurance. And one segment is people who are above the age of 65, because if you live in the United States and you're above the age of 65, then you are eligible to receive Medicare, which is a government-provided insurance plan. At the same time that Medicare was introduced during Johnson's administration in 1965, Medicaid was also introduced at that same time. So Medicare and Medicaid are two different health care provisions for particular segments of people in the United States. Medicare is provided to people who are elderly. Medicaid is provided to people who are low income. And as we'll talk about next class, what constitutes low income depends on what state you live in. So after all of this, America ended up with a patchwork healthcare system comprised of 1, employer-based health insurance, 2, Medicare, and 3, Medicaid. So it's worth noting that the U.S. is the only developed country that lacks universal guaranteed insurance for all citizens. In every other developed country in the world, all citizens, if you live in that country and you are a citizen of the country, the government guarantees to give you health insurance. In America, that is not the case. If you have particular characteristics, we'll guarantee health insurance for you. So if you are low income, we'll guarantee health insurance for you. If you're elderly, we'll guarantee health insurance for you. But if you are relatively young-ish and relatively not economically disadvantaged, then the government in the United States does not guarantee health insurance for you. So what this means is that in the United States, we have kind of a significant portion of people who have no health insurance, which is, again, unique to other countries that are developed around the world. And the group of people who do not have health insurance in the United States are very much a mixed bag. So some of the uninsured people in the United States are uninsured because they're young and healthy. They don't want to pay for health insurance because they don't anticipate big medical bills, and so they just kind of gamble and they say, you know what, I'm just going to take a risk, not buy health insurance, and just anticipate that I'm saving myself some money because in the event I get, or it's unlikely that I will get sick and I'll have to incur medical bills that I have to pay for out of pocket. Other people are uninsured because maybe they're entrepreneurs and so they don't have employer-sponsored insurance. The amount of money they make disqualifies them from Medicaid, and buying insurance off of a private market is very expensive, and so they just decide, I'm just going to not be insured. Other people are super, super rich. Maybe they have easy access to health insurance, but they're so rich that they can pay for medical bills on their own, and so they choose to be uninsured. Okay, so what that leaves us with is this American model that is characterized by the following features. Feature number 1 is private health insurance markets. Okay, what this means is that people who are not old or poor seek insurance in the private market. The private market is centered around employer-based health insurance pools. People can buy plans individually, but these markets are smaller and vulnerable to adverse selection. Feature number 2 is partial universal health insurance. Partial universal health insurance means that there's subsidized universal health insurance that is provided to 2 vulnerable populations. One is the elderly, and the elderly group of people in America is provided with Medicare, which is universal health insurance for the elderly. And then the other vulnerable group of people are the poor, and the poor are provided with Medicaid, and so Medicaid is another example of universal health insurance for a particular subset of people, and in particular low-income people. Feature number 3 of the American model is private healthcare provision. So in the United States, most hospitals and clinics are private. There are some public hospitals, for example, the VA, but by and large, hospitals and clinics are privately run. And moreover, there are relatively few regulations regarding where doctors can practice and hospitals can open. So providers are free to offer any medical service they want to. There's not a lot of regulation in terms of what doctors are and are not allowed to offer their patients in terms of treatments. So even if a treatment is super expensive in the United States, if a doctor is willing to provide it, there's no kind of government regulation that says this is too expensive to offer to a patient. And so even cost-ineffective treatments technically can be provided by clinicians in the United States, so long as a clinician is willing to offer that treatment. And then the last kind of tidbit for private healthcare provision is that there are no direct price controls in the United States, so doctors and hospitals can charge whatever prices the market will bear. And so in the United States, healthcare prices are quite high relative to prices in other countries. And one of the reasons for this is because in other countries, specifically in countries that use the Bismarck model, the government comes in and they actually set the prices. And so by brunt force, the prices can't get super high because the government determines what the prices will be. In the United States, the prices can go as high as the market can bear. And so right now we have very high healthcare prices in the United States. Okay, so what I'm going to do for the American model is I'm going to kind of split it apart into different parts because there's a lot of moving gears here. And so we're just going to kind of tackle these parts in turn. What I'm going to start with today is part one, which, for the sake of this class, is going to be employer-sponsored health insurance. Okay, in the United States, if an employer provides insurance, then all employees end up in the risk pool, and this addresses adverse selection. Okay, the idea is that in markets where people are just buying insurance at will, the people who are healthy decide not to buy health insurance, and so we end up with an adverse selection death spiral. But one of the nice features of employer-sponsored insurance is that if I work for a company that offers health insurance and there's no way for me to kind of like get out of it, well, then that means I go into the risk pool. So even if I'm a young, healthy person who has low expected healthcare costs, I don't really get out of the insurance pool. So it kind of helps prevent this adverse selection where people are selecting out of participation in the insurance market when they're kind of cheap to insure. Okay, so if employers are providing health insurance to their employees, then it's kind of worth asking, like, how do they actually pay for it? So employers pay for the insurance that they provide to their employees via wage pass-through. Okay, what this means is that the employer, they will take the money that they're spending to get the insurance for their employees, and they'll take that out of the paychecks of the employees. So people who have jobs where the employer offers them employer-sponsored health insurance, their earnings in terms of like income levels are generally lower than people who work for companies where health insurance is not provided by the employer, simply because the employer has to like pay for the health insurance somehow. And so the companies that offer their employees health insurance, they have to lower their wages a little bit so that they can afford to buy the health insurance for their employees. Okay, at first pass, this sounds like it's kind of a bum deal for employees, because if you're getting health insurance from your employer, but then they just like lower your wages so that they can afford it, then it's not clear that this would necessarily be beneficial. But what I want to point out is that for some people, having employer-sponsored insurance is actually a huge perk, because one of the features of how employer-sponsored insurance works in the United States is that foregone wages are not taxed as income. So for particular people, if your company lowers your wages a little bit so that they can take the money that they have saved and buy you health insurance, then overall this will actually result in the employee being richer than if the company that they're working for was not offering them health insurance and just giving them higher wages. Okay, so let me give you an example of how a wage pass-through would be advantageous for a particular person. Let's think of a hypothetical guy named Joe who is compensated $40,000 for his work. So in other words, the amount of service that he provides to his company should credit him $40,000. Okay, just for simplicity, let's suppose that wages are taxed at a constant rate of 10%. So every dollar that this guy brings home in a paycheck is taxed at a rate of 10%. And let's suppose that health insurance for this guy costs $6,000. Okay, we're going to do a head-to-head comparison of two situations that Joe might be in. One, Joe's employer might not provide Joe with insurance, and then alternatively, Joe's employer may provide him with insurance. So if Joe's employer does not provide Joe with insurance and he has to pay for it on his own, then the amount of money that Joe would have would be equivalent to the amount of money he would take home on his paycheck, which would be $40,000. So that's the amount of money he's earned for the work. All of those $40,000 are taxed at a rate of 10%. So he gets to keep 90% of the $40,000. But then since his company hasn't provided him with health insurance, he's going to have to go out and buy it on his own. It costs $6,000, so he's going to take his post-tax earnings, subtract from that $6,000, and after that whole series of events, Joe will have $30,000. And again, that's in the situation where his employer does not provide him with health insurance. Okay, if Joe's employer does provide him with employer-sponsored health insurance, then what would happen? Well, the company owes him $40,000 in total. So all of the kind of benefits they give him need to add up to $40,000. So if part of the benefits they're giving him are health insurance, and the health insurance is worth $6,000, then the paycheck that Joe would get would be equal to $40,000 minus the $6,000, because this is where the wage pass-through is coming in. The company is lowering Joe's wages by the amount that the insurance costs that they're providing him. So at the end of the day, Joe's going to get a paycheck that is equal to $34,000, and then on top of that, he's also going to get free insurance from his company. And so he's going to take just the amount of income that he gets in his paycheck, which is the $34,000. That's going to be taxed at 10%, so he's going to get to retain 90% of that. And then in total, he's going to have in his bank $30,600. Okay, compare this back to the situation when Joe didn't have employer-sponsored insurance and he had to buy it on his own. When he had to buy it on his own, his bank account was sitting at $30,000. When he didn't have to buy it on his own, his bank account was sitting at $30.6 thousand. In both situations, he's getting health insurance, but he's richer when it's provided to him through his employer, and that's simply because any kind of foregone wages, which in this case, wages are being foregone because they're being kind of shifted over to health insurance, those are not taxable in the United States. Okay, so for this guy, Joe, getting his health insurance through his company is clearly advantageous. But what I'm going to point out is that wage pass-through doesn't save money for relatively healthy employees. Okay, the previous numbers that I gave you for Joe only worked because Joe implicitly was kind of the average employee. So the cost to buy insurance privately for Joe was equivalent to the cost for the insurance company to provide insurance for Joe. So to help you kind of understand this, let's consider the following picture. If you are a company that employs people and you have insurance that you're providing to your employees, then in your pool of employees is going to be a spectrum of people with different health. So there's going to be some people who are pretty sick that work for you. There's going to be some people who are relatively healthy that work for you. The people at different ends of the spectrum are going to have different healthcare costs. So really the amount of money that you're going to have to pay to insure these different people is different. But across the pool of employees, there's going to be some average employee. And let's say that the average employee has a kind of expected healthcare cost of $10,000. So the average cost across the pool is $10,000. Okay, if the sickest person who works for this company has a cost to be insured of $19,000, but the company is taking a consistent $10,000 out of everybody's paycheck, then for the sickest person who works for this company, like, they're especially benefited by having employer-sponsored insurance because their paycheck, when they get employer-sponsored insurance, goes down by $10,000. The alternative situation of them not having employer-sponsored insurance would not be them paying $10,000 out of pocket for insurance. The alternative situation would be them having to pay $19,000 out of pocket for insurance. So if they didn't have employer-sponsored insurance, they'd get hit twice. Once, because all of their income would be taxable, and the second way they'd be hit is because when they have to buy the insurance on their own, the amount that they would have to pay for it would be much higher than what the than what their employer would have to pay for it if they were just kind of buying a bulk policy for their whole pool of employees, so that each employee kind of costs them a mediocre amount. Okay, the person who's going to be hurt by employer-sponsored insurance is going to be someone who's relatively healthy. So consider a guy on the other end of the spectrum. Maybe he has incredible health, and so if he was going to buy insurance on his own, then maybe it only cost him $1,000. Okay, if he gets employer-sponsored insurance and the employer is taking a fixed $10,000 out of everybody's paycheck, because that's kind of like the average cost of insuring the average person in the company. Well, for the healthy guy, the two scenarios for him are, one, his boss takes $10,000 out of his paycheck, but it might be more beneficial for him to actually kind of not have anything taken out of his paycheck, his entire earnings be taxed, and then on his own buy health insurance, because he's so healthy, he could buy it independently for a relatively small amount, maybe only $1,000, which could be kind of a better situation for him than to have $10,000 taken out of his paychecks in order to get employer-sponsored insurance. Okay, so there's empirical evidence that employers deduct different amounts of money from employees' wages depending on the employee's demographic group. And the reason they kind of deduct different amounts from people's paychecks, which is kind of this example of wage pass-through, is because the idea is they don't want healthy people, like the guy who could buy insurance on his own for $1,000, to just quit working for them and go find another company. And so what employers do, or at least there's evidence of them doing this, is they can kind of take their entire group of employees and they can put them into pools. And so they're going to put people into pools based on their observable demographics. And so what an employer sees, well, a part of asymmetric information is that the employer doesn't see people's actual physical health. But what they do see is they can see a person's gender and they can see a person's age. So what an employer might do is they might take all the old men who generally are kind of expensive to insure. They might take more out of their wages. And then for people who are young and female, who generally have very low healthcare expenses and are cheap to insure, they might take less out of their wages. And in this way, the employer, they kind of create these little pools of employees based on kind of how much it costs to insure them. And then each pool could be assigned a different amount to be deducted from their earnings, so that this wage pass-through thing doesn't incredibly penalize people who are relatively healthy, because they're having to like completely subsidize the people who are kind of expensive to cover because they're relatively sickly. One other kind of thing related to this is employer-sponsored insurance can lead to job lock. Job lock is effectively a rigid labor market that occurs because people are afraid of losing their employer-sponsored health insurance. So one of the concerns with the American model is that when we have employer-sponsored health insurance, then if you have a job that offers you insurance, great, but if you want to like switch jobs or quit your job and become an entrepreneur, then your health insurance becomes kind of at risk because it's tied to your employment. Okay, the reason this is problematic is because in an ideal world, we want a very fluid labor market where people are just like shifting over to the jobs where they do the best work and where they kind of are the most efficient. But the labor market becomes rigid when people are afraid to kind of like move employers or like start new companies and become entrepreneurs, because in doing so, either temporarily or for a long amount of time, they'll be uninsured. And people are scared to be uninsured because then in the event they get sick, they're going to have to pay for things out of pocket. And so people kind of stay locked into their jobs, not because their particular position is the most suited to their skill set, but because they're just afraid of losing their health insurance. So policymakers kind of realize that this is a problem in the United States. And so in order to encourage job mobility, COBRA was introduced for the specific purpose of encouraging, with one of the purposes being to encourage job mobility. Okay, a really, really quick overview of COBRA. So COBRA was introduced in 1985. It mandates that firms offer former employees the opportunity to continue on their employer-sponsored health insurance plan. after they're terminated. And typically you can continue on your employer-sponsored health insurance plan for up to about 18 months. The catch is that the workers have to pay the insurance premium that the employer was previously paying themselves. So if their company used to be paying $1,000 per month for them to have insurance, then that same insurance is offered to the employee after they quit or are fired. But the previous worker has to pay out of pocket now the amount that their company was paying for them to be insured. Okay, the reason that this is kind of viewed as helping with job lock is because COBRA temporarily decouples insurance coverage from employment. And so by kind of severing the tie between having a job and having health insurance, it encourages job mobility, which is something economists are interested in. Okay, I'm going to stop here for today. Again, make sure you're reading the textbook because they kind of fill in some of the details that I'm not covering for the sake of time. After 10 minutes, we'll meet back for the exercise. And in the meantime, if you have any questions, let me know and I'll try to answer them. For today's exercise, I'm going to have you read kind of a little, I don't know if you call it an article, it's like a little snippet of some research that was published by the National Bureau of Economic Research, or the NBER. So today we talked about how there are tax breaks for employer-sponsored health insurance. Every time the U.S. starts talking about healthcare reform, one of the questions that gets raised is whether or not we should quit giving tax breaks for employer-sponsored health insurance. So an economist named Jonathan Gruber, who was kind of the architect of Obamacare, put out this piece that kind of offers the pros and the cons of having a tax exclusion for employer-sponsored health insurance. And the link that I'm going to put up on the Blackboard page takes you to kind of an overview of the arguments that he makes. So what I would like you to do for the exercise is I would like you to read tax breaks for employer-sponsored health insurance, and then consider the pros and the cons of the current tax exclusion for employer-sponsored health insurance. Then after you've considered that, state whether you would be for or against getting rid of the current tax exclusion for employer-sponsored insurance, and why. So kind of back this up by providing some kind of argument for why you think retaining it or getting rid of it would be the best kind of thing for a policymaker to do. That is it for the day. Just as kind of, if you need some guidelines in terms of how long you need to make this, I would write at least a paragraph in your exercise response, and then if you want to write more, that's great. So maybe like 1 to 2 paragraphs for the exercise. And that's all that I have for you, so I will see you next class.